Hello everyone, let's get on with the third part of the introduction to dental materials. Selection of a suitable dental material. Whenever a patient comes with any disease of the oral tissues or a dental tooth, a dentist has so many options at his disposal to eradicate that disease. For example, a patient comes with a caries tooth. Dentist has a vast variety of dental materials, restorative materials, to restore the normal function and aesthetic of the tooth. A dentist has to make a right choice to restore the diseased tooth, and these are the steps a dentist must have in his mind while choosing a suitable dental material. First of all, he should analyze the problem. Secondly, the consideration of the requirements of patient. Thirdly, the consideration of the available materials that he has available in his dental office, and he should have a knowledge about the properties of those materials. And finally, the choice of a suitable dental material to restore the normal function of tooth. Analyzing the problem is the first and most important step while choosing a suitable dental material to treat the defective tooth structure. If the analysis isn't correct, it will lead to the wrong treatment plan, poor prognosis, and finally the failure of the treatment. For example, while choosing a filling material, if we know that the caries is too much deep, we will have to use that filling material which is non-irritant or least irritant to the dental pulp, so that it should not cause any problem later on to the dental patient. Consideration of the requirements. Well, a dentist must make a checklist in his mind of all the requirements that the material must meet, and these requirements are dependent upon the situation. For example, if we are talking about the filling material, let's suppose if a dentist has to restore an anterior tooth, then the requirements are going to be different. Physical properties as well as the mechanical properties are going to be important. Physical properties, for example, aesthetics is going to be of a primary importance. Whereas in case of posterior teeth, where the physical properties like aesthetics is not that important, the mechanical properties are going to be much more important in case of posterior teeth. So it's dependent upon the situation what are the requirements that a material must meet. Consideration of the available materials and their properties. Well, a dentist must have a clear concept about the properties of all the materials that are available to him in the dental office. For example, if there is an immediate problem, he will have to choose from the materials which are already available to him. So he should have a very thorough knowledge of the properties of all these materials available to him in his dental office. Well, there are advancements going on in the field of dentistry, like new techniques are being introduced. Similarly, there are advancements going on in the field of material science as well. New materials are also being introduced in the field of dentistry. So a dentist should be up to date with all the recent advancements going on in the field of dentistry in order to give much better and improved treatment to his patient. So in this step, we basically compare the properties of the materials which are available to us in the dental office with the requirements, the checklist that we made in the second step, in order to choose a much more suitable material to restore the natural tooth. Choosing the right material is the final step in selection of a suitable dental material for any particular disease. Like when a patient came to us with any particular disease of the tooth, we had a vast range of restorative materials in our mind, like amalgam, glass ionomer cement, compomer, composite. We had a vast range of these restorative materials. But as we moved along, step by step, we narrowed the range, and we finally came into conclusion of one material which is best suited to treat that particular disease. The availability of the material, the ease of handling, and the cost effectiveness are other few factors which a dentist must also take under consideration while choosing a suitable dental material. So that's the end of the third and final part of the introduction to dental materials. I hope these lectures were helpful for you for understanding the basics of the dental materials. Just keep all these basics in your mind, and they are going to be quite helpful for you later on when we study the individual materials. I am Dr. Rashid Hassan. If you have any questions, you can inbox me. Thank you very much. Take care.
स्पीकर का वॉल्यूम उसको तेज पसंद है, बेबी को बेस पसंद है, ओ बेबी